Hello, my name is Yana Bannikova, and I want to talk to you about the effectiveness of integrating creative arts interventions into trauma-focused cognitive behavioral therapy with children and adolescents who have experienced trauma. Children today experience numerous strategies and challenges involving household violence, abuse, community violence, terrorist attack, natural disasters, you name it. Children trauma is a significant concern in the United States. Childhood trauma, as we know it, can lead to short and long-term mental health concerns. Traumatic experiences also influence children's brain development, specifically when trauma occurs at a younger age. The use of trauma-focused cognitive behavioral therapy, TFCBT, with children who have experienced trauma has been identified as having the highest level of research evidence. However, children often need alternative outlets to communicate their experiences and feelings in therapy that goes beyond the spoken word. Creative arts mediums are an effective outlet for this expression. I picked this issue because I truly believe in the healing power of art therapy. I have extensive experience with art therapy with a variety of population, and I'm an artist myself. Creative arts interventions can successfully be integrated to enhance therapeutic models such as TFCBT. Some of the main creative arts interventions that could be integrated are the use of creative writing, visual arts, drama, dance movement, and music. Let's talk about method. 16 participants, children and adolescents, regardless of gender, ethical background, and socioeconomic status, were randomly chosen from a local mental health center. All participants met criteria for PTSD diagnosis or had signs of post-traumatic stress symptoms. All participants were 7 to 17 years old, and of course, the consent of their caregiver was obtained. The study used randomized controlled trial. This experimental design permits the comparison of the participants' post-traumatic stress symptoms before and after the intervention using the Child and Adolescent Trauma Screen, which is CATS. All 16 participants were randomly assigned to 2 equal groups of 8, the experimental and control group. The pretest was given, then each participant in the experimental group received creative arts intervention with TFCBT for the period of 20 weeks, consisting of 1.5 hour weekly individual sessions, and the control group participants received only TFCBT for the same period. And of course, after the interventions, both groups were screened again using the same questionnaire, and these are the scores that we are comparing. An independent samples t-test was conducted to compare post-traumatic stress in experimental and control groups, and there was a significant difference in the scores for control group and the experimental group, which concluded that the control group has higher post-traumatic stress than the experimental group. What it means? That means that this randomized control study tested the significant difference and rejected the null hypothesis. This indicates that the present study proved the effectiveness of integrating creative arts interventions into TFCBT practice and reduced post-traumatic stress symptoms in children and adolescents. So I want to talk about limitations, which is very important. First, small sample size, only 8 participants. Future research might be done on a bigger sample group, such 50 participants, and so on. This study used a self-report CATS questionnaire. The future studies can adopt other screenings and assessments tools. The entire intervention was designed as an individual therapy process. I would like to see how future research might benefit from applying the same intervention in a group therapy. This research used a random sample consisting of male and female participants. Maybe future research can be focused on a specific gender or age or sexual orientation for older kids. And another consideration is that the focus of the present study is the participants who were patients of a mental health clinic already and have been in treatment. Maybe a comparative study can be conducted with children and adolescents who never sought treatment. And finally, integrating creative arts interventions in TFCBT is adequate and efficacious in improving post-traumatic stress symptoms in children and adolescents who have experienced trauma. This means that this intervention worth the exploration of researchers and counselors to best meet the needs of children with trauma survivors in treatment and improving post-traumatic stress symptoms.